physician's office. Hey, Dr. Wigoda.
Hey, how are you?
Good.
Welcome to my office.
We heard you're going to give us a tour today.
We're going to give you a tour. So, when you walk in, this is the waiting room.
These are great pamphlets.
So, we have brochures on all the different procedures. There's a lot of thank you cards from patients, both cosmetic surgery patients and patients that were injured in accidents. And patients will check in here. This is the nurse's patient. There's Marie. You can see here's more thank you cards and articles where it was quoted.
Dr. Wigoda, how long have you been practicing plastic surgery?
So in a couple months it'll be 17 years, since 1999.
What are some of your top procedures?
The most common procedures are breast procedures, breast augmentation with lifts, breast reductions. We do a lot of liposuction, a lot of Brazilian butt lifts, tummy tucks, and then there's all the different facial procedures, facelifts, eyelid surgery, noses. So a little bit of everything, with the most common being breast surgeries.
So when somebody comes for a consultation, what happens next?
So they'll fill out paperwork so we can get their medical history. We want to know if they're good candidates. Not everyone that wants surgery is a good candidate for surgery. So they write down all their medical history, and then they'll come into the consultation room. So we can go back to the consultation room. So if you want to just take a quick look here, this is the consultation room and also the esthetician's room, where she'll do facials, laser hair removal, and that sort of thing.
What inspired all of these flowers and the painting?
So we just wanted to brighten up the office a little bit, and if you've seen the consultation room, go ahead.
This room is so pretty.
Oh.
It was painted by an artist. If you close the door, you can see what people feel like they're on vacation, looking out the window when they're getting their Botox or injectables. It kind of relaxes them a little bit. So here we'll do the consult. Patient will be examined. They usually get a robe. We'll talk about what they're interested in, and examine them, and then we'll discuss what the options are for the procedure. So then they'll get dressed, then they'll go talk to Marie, who will do the pricing and do the scheduling. So then usually, once they're scheduled for surgery, I'll see them a couple weeks before the surgery just to go over everything. A lot of times with breast augmentation patients, they may change their mind. They may want to go bigger than we talked about, or smaller. So that's finalized a couple of weeks before the surgery. We take pictures, so we have the before pictures, which we use in the surgery as a guide sometimes. Usually payments are made, they sign consent forms, we go over all the risks of the surgery, what complications there could be, and then...
Question. What are some of the biggest mistakes you see when you're giving consults that patients make when they're making a decision on plastic surgery?
I'd say one of the biggest things is shopping for plastic surgeons based on price. Here in South Florida, there's a lot of plastic surgeons, and there's a lot of non-plastic surgeons doing plastic surgery. So it's legal here. You could be a gynecologist, you could be a family doctor, you could be a brain surgeon and decide you want to do plastic surgery, and that's perfectly legal. The problem is they're not really trained to do that, or they'll take a weekend course where plastic surgeons spend years learning how to not only do the surgeries but take care of problems, when there are problems.
And the more times you do something,
Of course, the more times you
Yeah.
do an operation and also see complications, you know how to avoid them, and then you know how to treat them.
And
So-
what would someone look for in a doctor to know that they're credible?
I mean, the first thing, you obviously want to meet the doctor. You want to feel comfortable with them. I hear from a lot of patients that go to other places, the doctor spends like 30 seconds with them and then he's out the door. I tend to spend at least 15 to 30 minutes talking to them because I want to know that they're a good patient, you know, a good candidate for the procedure. It's not just them choosing me, I'm also choosing them. I don't want to have patients that don't have realistic expectations. So it's almost like we're interviewing each other.
and so you got a call right before we started filming that you have to go do a surgery at Broward Health. So you're also,
So I also do trauma reconstruction and hand surgery. I'm the chief of Broward Health, and I also go to Broward Health North, as well as Holy Cross Hospital. So when someone gets injured and requires a plastic surgeon, if I'm on call, then I get called in, and then I have to go do that.
so
kind
that
of
just gives you a lot more practice.
Wow.
So, yeah, a lot of different surgeries. So today we did a few breast surgeries. Now it's close to 5 o'clock, and I'll be heading to the hospital to do a couple of, actually one hand and arm trauma surgeries.
So where did you do the breast surgery today?
So we did the breast surgery, the 2 breast surgeries here. I'll show you the operating room.
Okay.
You ready to go?
Yeah.
Okay. So this is our operating room. So you can see that's an anesthesia machine. We do general anesthesia, which basically means the patient's completely anesthetized, doesn't feel anything. This is the operating room table. It goes up and down. Patients can be sat up. And when we're doing breasts, we always sit them up once the implants are in to make sure everything's symmetric. And then there's all different kinds of equipment here that we use for the procedures. This is anesthetic medications. We have a crash card if anything happens to the patient. Luckily, I think we've been here 13 years with the operating room and have never really had any issues as far as that goes.
And is this an accredited surgery center?
So this is we'll call it a Quad A accredited surgery center. So every 3 years they come in to inspect the operating room and the office and all the paperwork. And we also send reports to them continuously throughout the year, but every 3 years they actually physically come and do the inspection to make sure everything is the way it should be for the patient's safety. So if you're having surgery in a doctor's office, you want to make sure they're accredited. You want to do research on the doctor, you want to do research on the facility and see if there's been any issues. There was a recent death down in Hialeah, and had anybody done any research on the doctors and on the facility, they probably would have already found that they had some issues and probably chosen not to go there. So really patients need to do their research. There's so much on the internet, both good and bad, about plastic surgeons, about surgery centers, and so if you see enough negative stories, then you really need to be looking somewhere else.
Like when there's an ad for maybe $2,000 for a breast implant.
Right, there's a lot of very discounted surgeries, more so, well, both in Miami and here in Fort Lauderdale. There's a lot of centers in Miami that really very inexpensive surgeries, and you have to wonder, what they're cutting on to be able to do the surgeries at that price when every other plastic surgeon is, significantly more expensive. And what you'll find is, the quality of the surgery isn't very good. The quality of care afterward is not good. My patients, when they come here on a bad day, they might have to wait half an hour, for me, whereas at some of these centers, they'll be waiting for hours to see somebody. It's usually not even their own doctor that did the surgery. And then if they ever have a problem, then, they may get a different doctor, they get the runaround. And so that's really the issue with these cheap, we call them butcher shops, surgery centers.
Okay, well,
So-
we know you have to get out for your next surgery, so any last words that you want, a piece of advice you want to give to viewers?
I would just say do your research on the doctors. Luckily we have the internet, and so it takes 5 or 10 minutes. Just put the doctor's name in and see what you find.
Okay, perfect. Thank you for your time.
All right, thank you.